Okay, hi everybody. Imogen and I are back for another chat, and this session's topic is all about proprioception. So, first of all, welcome, Imogen. Nice to see you.
Hello.
So, first of all, I'm going to explain a little bit about what we mean by proprioception. It's really thinking about what we might very, on a basic level, describe as the mind muscle, mind movement, kind of connection between different things, our body's ability to do different things that everybody should be able to do and does do on a daily basis. You know, we wouldn't be able to move if we didn't have proprioception, and it's looking at our body's ability to sense movement, actions, the force of those actions, and the location and the body, kind of how you kind of respond to how your body moves, and knowing, for me specifically, when I work with people, what you are doing in terms of, if I'm doing an exercise, for example, do I know, A, obviously which body part to move? Most people should be able to do that, but which specific muscles am I working when I am doing that? And am I using the correct ones for what it is that I'm trying to target in terms of my goals, whether it's kind of strength training, stability, improving range of motion and general kind of mobility. So although everybody does proprioception, just to move their bodies around and do what you need to do using your senses and moving your body, actually when you've got specific goals, or you're trying to recover from an injury, for example, and you're trying to either rebuild strength or rebuild kind of range of motion again, you really have to understand your body very well and know how to actually activate muscles, move in a specific way, and do it safely as well, particularly if we're thinking about injury rehabilitation or even prehabilitation to kind of prevent injury as well. So I'm going to talk a little bit about what the benefits are in terms of my clients when it comes to kind of strength training, performance in athletes, and what I do with some people when it comes to kind of injury rehabilitation, doing strength training to do that. And Imogen's going to kind of cover how you think about that, how you do that a bit more, how you would engage, brain to movement or brain to muscles a little bit more, and also linking that into kind of how massage can actually help you as an additional tool to understand that a little bit more as well. So firstly, in terms of the benefits of proprioception when it comes to strength training, I would say that the best benefits are particularly not just with kind of isolated exercises. So let's take the bicep curl, for example, where you really want to isolate bicep as much as possible, both in terms of strength and maybe muscle growth, and knowing, perfect technique, how to not only move the arm, but where to hold the arm, how to really engage with that muscle, get the maximum efficiency out of that exercise, but also compound movements. So let's say, squats and deadlifts and things like that. You're using, multiple muscle groups. So you've got to think about lots, but again, even within those types of exercises, you can specifically work some muscles more than others. So, for example, doing a squat, depending on the type of squat that you choose to do, and what your technique is doing that, then obviously you can also target some specific muscles a little bit more. So it could be a bit more quad focused or hamstring focused, or even going into glute focused. So knowing the type of exercise, but also how to activate those muscles a bit more doing those. So it's literally thinking about those muscles as you're doing that exercise, squeezing them, learning how to just feel them before you even start. So one of the things that I do, both for improving performance in athletes, and people who are doing strength training, but also in some of my clients for injury rehabilitation, who actually the injury has occurred over a period of time because they've actually been overusing certain prime mover muscles and not perhaps engaging with some other stabilizer muscles, or even some of their bigger muscle groups like their glutes, for example. Some people do find that the glutes are kind of a weaker area when it comes to lower body type exercises. They're overusing quads, for example, and then they get knee injuries because they're putting too much through their quad tendon, a bit like a tendinopathy, rather than equally using other muscles, particularly glutes, for certain exercises, or running, for example, is a good one. But they're not engaging with those glutes, and they find it really difficult. They think actually it's a big muscle group, they know how to engage with it, they can squeeze their bum, but actually when it comes to doing the exercise and using them correctly and knowing when to use them can be quite tricky for people, and actually tend to be a lot weaker than they think they are. So we work a lot on things like glute reawakening or activation, just as a kind of means of, this is something you need to be thinking about a bit more, mind muscle connection for so many different, not only specific exercises, but also kind of daily activities where we should be squatting a bit more, we should be using our glutes when we're walking around, just in our everyday. So people find that improving, going back to the foundations really of strength training and prehabilitation to prevent injury, just building a really good mind muscle and mind movement connection can provide so many benefits going forwards. And of course, a lot of the people I see, it's because of injury rehab, so therefore they're having to go back down to baseline again. But they find that just as soon as they start doing that, making that mind muscle connection really clear, really a lot more kind of active than they were before, that improves their performance no end. It changes the way in which they might run or they lift, and it makes a big difference. And when you come back down to basics and make sure you've got that foundation really well, then you can make so much more in terms of improvements, both in strength and in performance, when it's things like cardio as well. So there are some really good benefits of kind of stripping everything back a bit. And you have to go lightweight to start with, because when you go too heavy, often you end up employing some of those kind of bigger muscles, the muscles you find it easier already to have that mind muscle connection, and then you just kind of don't again use those other muscles which you should be using a lot more of. So actually stripping the weight back a lot, or even going body weight with a lot of the exercises where you're just trying to engage those muscles a bit more, is really key. And then once you've got that, it's a bit like people have a bit of a light bulb moment sometimes when they're doing specific movements. They're like, yeah, I really know how to activate this, and literally isolate it away from other muscles as well. Know where it is on the body, know how it moves that body part, and you're able to do it automatically rather than really then having to think about it all the time. It makes such a difference going forwards, and then you can really progress with the way in which you want to go, as I say, whether it's strength training or whether it's just in general athletic performance. So it is there are so many benefits to really working on it and concentrating on it for a period of time, even if you've been an athlete for a long time, or someone who lifts weights for a long time. It's easy to kind of leave out certain muscle groups, or not even know which muscles you're supposed to be using some of the time. I see some people training and you can see that they clearly aren't quite sure what they're actually training, because of their technique is not quite there. And you think, well, actually, I think you probably think you're doing a tricep exercise, but actually you're actually targeting shoulders a little bit more, for example. So really knowing what it should feel like, what it should look like, using your senses a little bit more is really beneficial in the long term. But the question is, how do you do that, Imogen? How do we get that feeling? What kind of things do we do? What should it feel like? And how do we know that we're doing the right thing?
Yeah. So there's quite a few, I suppose, little tips and tricks that we can kind of do to kind of help sort of strengthen up the sort of like awareness of your proprioception. One of the big ones I will sort of tell people about is sort of using like like you say, visualizing it. So I generally find if you can have that sort of like base understanding of like your muscle groups. So
Mm.
not necessarily knowing the exact locations of where everything is, so you don't need that, but knowing that your quads sit on the front of the leg, that they're coming from sort of the hip towards the knee, so they're stretching over at the front of the leg, knowing that that's where that group sits, knowing the hamstrings are on the reverse side, so they're sitting from sort of like glute area down to the back of the knee, this type of thing. Having that sort of like knowing that if these are the sort of joints that they're sitting between will help give you an idea of when you're doing specific movements what muscles should be moving, because you should not be able to then work out that, say, like if we're saying take the hip or the knee, for example, given I talked about quad and hamstring, that if you're doing something that's flexing the hip, extending the hip, if you're doing something that's flexing or extending the knee, that the quads and the hamstrings are likely to be involved because of the movement of the joint that you're doing. So having that sort of awareness there of like that understanding is quite useful. And there's loads of tools out there as to how to learn your muscle groups and stuff like that. There's little fun quizzes and all sorts that you can do to kind of get that base understanding. Or if you don't know necessarily, you don't even necessarily need to know names per se, of just like having the understanding of like what's there. So one of the ones that you can do is that I do with people in clinic, so that they kind of get of going this muscle, is that you can kind of use like a resistance band, for example, and just hold it between joint to joint and then move, and so you can see what's happening sort of more visually with as the band stretching and lengthening, then you know that that muscle is doing something similar. So it doesn't mean that you need to know the name that say if you're doing it on the front of the leg that's the quad. You just know the muscle that's sitting there that you can feel and see is moving like that with the band. So that's one of the sort of like ways to kind of get an understanding of how things are moving and what your body's doing with the certain movements and stuff.
And I think actually just it made me think, but you saying that, another reason why, particularly when I'm thinking about strength training, when you're looking at people training in gyms and things, why there are so many mirrors in gyms. It's not just because everyone wants to look at themselves in general and see how big their muscles are growing when they're training, but you can literally watch your muscles move. So again, another great example is bicep curls. So you can literally watch, as if you're doing it correctly, and if you think you're doing it correctly, you can watch that bicep lengthen out, and then you can see it contracting as it goes back in. And you're literally watching those muscles, you're watching the movement, like you say, of the arm, looking at where that is. And obviously, you can tell the difference between, whether you were getting a bigger contraction or not, for example, based on just watching how it moves and testing out different positions, different techniques, and just seeing the difference in what's going on in those muscles. So, like you said, the example of the band is a really good example because you can literally see it. But equally, if you're somewhere where you are training, or you can watch, what the muscle is doing in a mirror, that's really helpful.
That's like I say earlier, I was saying to you, wasn't it? The other bit you can do, like I find the band's useful to get the understanding of the muscles and what they're doing. But like you say, if you've not got access to a band, or you're not doing something, or you're in the middle of a workout and you're needing to focus on this, like you say, you can watch the arm movement, but going further on that, you can then watch things like if you're wearing tighter clothes, or watching how the clothes are moving. Now that's kind of a little bit crude, but it will give you a base understanding of how things. So if you're, like you say, if you're doing the bicep curl, you'll watch as the clothing stretches down or curls back up. Same way you could do the same with the skin. Again, it's a little bit crude and depends on the movement as to whether you'll be able to see it, but you'll be able to see that sort of like compression and stretch through the skin. Watch that and give you the idea. The great thing with watching with sort of the skin side of stuff is you also then get the sort of the sensation side of it as well. So you'll feel the stretch, you'll feel the contraction, so the that tightening up and bracing type movements as well when you're looking for that type of thing. So I quite like for that one. And then equally, when you're doing the exercises and if you're paying attention in those ways, you can pay attention to what's feeling tired? Like we all know if we've done stuff when it's feeling like achy and that burn sensation. So where do you feel that? Like where do you feel the work done? Because that's again will tell you certain movements, that if you're feeling it more in certain areas than others, then which are likely to be taking on most of the work. So for example, with the squat, if you're feeling it more in the quad over the back and posterior chain, then chances are the quad's working more than what your glutes and the hamstrings are. So then that's again changing positioning, noticing if you then target slightly different and whether you feel it slightly differently. And sometimes it can just be a subtle movement that will shift all that sensation around. And again, obviously learning how those little movements are going to affect your training will then alter sort of the outcome, because things might not fatigue as quickly if you're working more efficiently and things like this. So just paying attention to that can be really helpful way to sort of work on proprioception. That's also the other bit I wanted to say with that, actually, is if you do struggle with that type of awareness, which I do find some people do, circling back to our video with the taping, that's also where that can come from, because you can watch the tape what the tape does and also feel where the tape's pulling. So if you need a little extra stimulus, try taping certain areas if you know where you're going to work. That's another way that you can feel it. And then also, I obviously with the massage side of things, massage can be really useful to help with sort of if you do struggle tapping into sort of feeling what bits of your body feel like when they're moving, because it helps sort of focus that attention to the area, because you've got a stimulus on the air working in a particular area, providing information to the brain. So it can be quite a useful tool to help build that connection from what does this part of my body feel like with the stimuluses and stuff. So yeah, the massage can be quite a useful tool to kind of help refine from that side of stuff and see how things respond, because you've got that extra bit of touch involved. And then the last one that I tend to find that's sometimes quite useful for people, and it can be quite an easy way and is also quite a nice relaxation tool, so I do recommend people, like anyone, to try it, is with like a body scan. So you can simply just lay down or sit down, like whichever sort of environment you're in, what suits, and you basically just work your way through your body, either sort of just wiggling toes. Some people do it with like the progressive muscle relaxation, so you can contract and relax with breath, but simply just wiggling, moving in a certain area, focusing on that particular area. So if you're sort of wiggling toes, seeing what the foot feels like, what other sensations you're brought to your attention as you're doing that, making any mental notes of what things feel like, and then you can just basically work stage by stage up through the body, through the different areas if you've got time, or just focus on a particular area if you're wanting to do that. And again, just checking in and noticing what you feel like, what sensations are coming to the forefront as you're doing it. It gives a good sort of starting point to just kind of look inward.
Yeah, definitely. And I mean, coming back to massage a little bit in terms of when people come to you or come to myself for kind of sports massage as well, they might be saying things like, oh, yeah, I've got a really kind of achy lower back. And then you talk to them about the kind of movements, the activities that they've been doing, because obviously, you shouldn't, have that feeling. And it gives you clues also as to where people are overusing certain muscles and underusing others. And that, for me personally, when I'm working with people, when I'm kind of helping them either back from injury or getting them to understand the different movement patterns that they use, and maybe just adjusting those so that they're either building strength in weaker areas that would improve performance, or where they've got a niggle, or they often get sore, or as I say, kind of lower back pain and things like that, which is still very common, is often because it can give you a clue as to the fact that they are really overusing some muscle groups that are easier in terms of the proprioception, that mind muscle mind movement connection, like stronger back muscles, like quads, for example. example, but then underusing other muscles that they should be engaging with. Often, again, it could be glutes, or it could be other kind of hip stabilizer muscles. It could be abductors, or adductors in particular tend to be much weaker and underused, and should be used a lot more. So sometimes it can be, you know, weaker muscle groups, or just the lack of proprioception with certain muscles and not using them enough for certain movements, and over relying on other slightly stronger muscles that are easier to have that mind muscle connection with. And sometimes it is obviously also related to the actual movement, you know, the technique, or the general action, and the amount of force that people are putting into that action. So often, again, I mean, we've talked about this in some other videos in the past, but overusage of loading or overloading the spine when it's really not supposed to flex or extend too much out of position, unless you are bracing very well and know what you're doing in terms of bracing, you know, and then we'll end up kind of getting too much force, too much load, going through some of those spinal erectors, and again going into kind of the bottom of the spine, in the lumbar area in particular, and they're just being overloaded or overused. And that, you know, because the spine is not supposed to move significantly under load, and if it does, you know, that's where we talked about this in a previous video, bracing is absolutely key, because otherwise, you know, you are going to cause an injury. We get things like you know, delamination of the vertebrae, disc bulges, you know, trapping of sciatic nerve because of that reason, all sorts of things. So you know, it is really important, you know, it's a big part for me that I work with in terms of clients, whether it's general strength training and teaching them specific skills to help with this kind of thing, to prevent injury, or when we're coming back from injury and we're kind of building strength. You know, it's an absolute kind of key skill to make sure that that proprioception, that mind muscle or that mind movement connection is really strong in some areas where weakness has been, you know, has started. Making sure that we get those kind of nailed down as a foundation before then moving on to rebuilding even more strength going forward. So yeah, there are just so many benefits, and it's not easy to do, you know. Even I find it hard sometimes when I'm like, right, I'm going to try this new exercise. It's, let's say, you know, I often have issues with my rear delts, and you know, over usage of my front and my medial delts, and then not doing enough through the rear. And it's just, you know, sometimes not every exercise is going to be perfect for you in terms of activating or having, again, like I mentioned earlier, that light bulb moment. Oh, this is how it's supposed to feel, this is that perfect connection. And sometimes it takes working through either the same movement quite a few times. It could be body weight or very low weights, not heavy weights a lot of the time, because that's not necessarily going to help you to build that mind muscle connection. And sometimes certain movements just don't kind of provide that mind muscle connection for it. So it's about testing out different ones, finding the ones that work best for you, and then using that again to build on later. You know, and it does take time sometimes, even with big muscle groups like glutes, for example. Some people really find it very difficult to build that mind muscle connection with really using their glutes more than perhaps what they do. So what I would say is kind of stay strong, keep going with it, test out different movements, just think about that particular muscle, know where it is, like you've described, know where it is, what kind of job it's doing, how it should be moving, learn a little bit about it if it's an area that you know you need to work on, and then just kind of keep going with it until you kind of build that connection. If you are really struggling, then obviously, you know, you can come to professionals like ourselves who will help you to hopefully get that light bulb moment, and make sure that you are building a strong mind muscle connection with those areas that you need to. Okay, right, so another little topic covered. Obviously, we've mentioned a few of the other types of things that we've covered in the past, things like taping, for example. So do go and have a look at some of our other videos if those are topics that you feel you may be interested in. Right, thanks again for joining me, Imogen.
Thank you.
And we'll see everybody again next time. Thanks a lot. Bye.